Now, if you've been diagnosed with advanced liver disease or cirrhosis, you'll probably need to see a range of healthcare providers. The first one is your GP, who will really be the coordinator of a lot of your healthcare because they're the ones that will see you regularly and will do referrals to appropriate specialists. The next will be a liver specialist, and really the guidance is that for a GP diagnosing somebody with cirrhosis or advanced liver disease, they should be referring you to a specialist in liver disease. So that's a hepatologist or a gastroenterologist, depending on where you are. That specialist will be assessing your liver disease, making sure that the diagnosis is clear and that there is a management plan going forwards. And then they may recommend other participants in your healthcare team. Now, the first time your GP refers you to a specialist to talk about your liver disease, it's really important you take some information with you. It's really important that you've got any documentation of your prior blood tests, any previous scans that you've had, any previous correspondence from other doctors that you've seen about your condition or about other conditions. Having all that on hand is really going to help your specialist to really make a full assessment of where you're at the moment and what further investigations you might need to assess your liver disease and to maybe diagnose other conditions and to treat your liver disease. Now, either during your first consultation or after the consultation, a whole lot of questions might be going around in your head and you can't really get them out at the time of the consultation. So write them down, and the next time you have a consultation with your specialist, bring that list with you, and I'm sure all of those questions can be addressed in some form and appropriate responses given to you so you know. Lots of things will come up, lots of questions will arise, and it's really important that you get answers to them to really help you to optimise the treatment of your condition. Another key member of the health team, particularly in the hospital situation, is the liver nurse. And in many of the liver units, there will be one or often more liver nurses who will be able to guide you through this. And they'll be the main point of contact into that hospital department where the liver specialist might be sitting. So the liver nurse is someone who may be available to you by email or by phone call if something comes up, and who will coordinate your appointments, your investigations, making sure that you're getting regular liver screening and liver cancer screening, having your regular blood tests, and that you're coming to see the specialty team at the hospital on a regular basis. Liver nurses are available in the major liver units in the cities, but there are also many units out in regional areas where there's a liver nurse that will be available to you to coordinate your care. If nutrition's a big problem, there may be a recommendation that you see a liver dietitian. Now, they're a specific sort of dietitian, and you hear about dietitians for weight loss, for diabetes, and for other reasons, but a liver dietitian is generally someone who's a dietitian who is experienced in the sorts of nutritional aspects of liver disease that we need to be paying attention to. And those liver dietitians are available often during a consultation in a public hospital and sometimes out in the community. Now, if you've been referred to see a dietitian, they're going to do a few assessments. Firstly, they're just going to look at you and talk to you. They're going to measure your height, your weight. They might measure your waist circumference around your middle. They might do assessments of your muscle function, so something like a grip strength where we get you to hold a special device and squeeze really, really hard to see what your muscle strength is like. And they might do some more advanced tests of your actual nutritional state. Importantly, they're going to ask you about your diet, so it might be important in advance of that appointment to really record what you've been eating over the last week, what you've been having for breakfast, for lunch, for dinner, what you've been having for snacks, how often you might have takeaway food, how often you might have processed foods, etc. So having all that information on hand when you have that appointment could be really, really helpful, because otherwise you're going to be relying on your memory. And also between appointments, keeping a record of how you're doing, what you've been eating, how your weight's tracking, and all those bits of information may be really helpful for follow-up appointments as well. Now, unfortunately, many people living with advanced liver disease have declining health. That might mean significant impacts on your ability to work, to drive, to look after your family, to look after yourself. And there are a whole range of social services that are available to you should you need them. There's financial assistance through Centrelink, might involve a disability support pension. There are help with housing. There's help with accessing Medicare systems and financial services. There may be access to a social worker through your hospital that might be able to guide you and navigate you through these systems, or your GP should be able to help you with them as well. Many people living with liver disease think that this is something they've brought on themselves, and that's because liver disease is often due to alcohol, obesity, viral hepatitis from injecting drugs, for instance. It's not your fault. Liver disease happens, it's got multiple causes, and your healthcare team, your liver nurses, your liver doctors, know all that, and they're here to help.